Good news for health workers throughout the country. The Department of Health has completed a draft policy on the multi-drug resistant TB and extremely drug-resistant TB hardships aimed to address health workers' risks. This comes after medical staff at Daru Hospital threatened to stop work if the government continues to ignore their call to address these health risks.
They know what it's like when patients contract the multi-drug resistant TB and the extremely drug-resistant TB. They have seen firsthand how patients and their families suffer either financially, mentally, physically or socially. Their commitment to their jobs as health workers in a TB high-risk province has now resulted in 13 of these brave health workers living with the drug-resistant TB. This is why they are fighting for the government through the health department to ensure there are measures in place to protect them in their line of duty or support them when they fall victim to this life-threatening illness.
Within 2008 up until 2015, during that period of time we had 11 staff got infected. Measures were not put in place, infection control strategies and program during those previous years. And this matter was brought to us as unions, so we decided to take this matter further on administratively and then made our first petition that since we petitioned the Department of Health, nothing has come forth. This has brought up a lot of frustrations. So we decided that it is best appropriate to do a follow-up petition again to the board.
Following their second petition 7 days ago, the health department has responded positively, immediately forming a working committee to complete the multi-drug resistant and extremely drug-resistant TB hardship policy.
So the draft policy has been completed yesterday at 3 o'clock and it's pending for further negotiation with the Department of Personnel Management. So the timeline in preparation for this before it is finalized is month of June has been assured by the Department of Health.
In Daru Hospital alone, one community health worker was forced to resign due to hearing loss, a side effect of taking the TB drugs.
The staff has suffered 250 injections and in just 15,000 pills. That's having very serious side effects, and which include blindness, loss of hearing, and speech defects.
Charmaine Poreambe, TVWan News.